Thank you, Mr. Mansfield. I'd like to call the first witness, who is Ellen Clifford. Ellen, I think you might be on mute.
Hi, Lorna.
Hi, Ellen. Thank you for your statement. I understand that you provided a statement on the 3rd of April, a statement of about, I think it's about 10 pages long. And at the bottom, you've signed it and you've said, I confirm that the opinions I've expressed represent my true and complete professional opinions on the matters to which they refer. Is that correct?
That is correct.
Thank you. Could you tell the panel and everybody watching what your occupation is, please?
So I am a disability consultant. I have campaigned and worked in the disability sector for the past 23 years. I'm also author of a book on disability that was published last year in June 2020.
Thank you. I just want to start with a really basic point. This isn't a test, but can you give a definition of what disability actually is under the law?
So according to the Equality Act, it's a long-standing impairment that affects your ability to function day to day. So when we use the term disabled people, we are talking about people with a whole range of different impairments and illnesses, ranging from long-term health conditions to physical, sensory impairments, mental health issues such as I live with, for example, learning difficulties, autism, etc. And I think, you know, that's quite a wide group of people who are actually included.
And you make a reference in your witness statement to what the social model of disability is. How does that compare with what the definition by law is of disability?
So the social model focuses more on the external barriers which disabled people face as a result of the way society is structured and organised, and the way that disabled people experience socio-economic oppression in the way that we're excluded from society. So the legal definition is focusing very much on our impairments or illnesses, our bodily conditions, whereas the disabled people's movement in the UK, we follow the social model, which is looking at the external factors which cause people who live with impairments and illnesses to be excluded and marginalised and treated unfairly.
Understood. Now, obviously you've written a lot about disability, and you are a campaigner. Can you explain just broadly the ways in which disabled people have been disproportionately impacted by COVID-19?
Yes, I have written a lot because there are numerous ways, and apologies for the length of the witness statement, but disabled people have felt in particular that our voices have not been heard within the wider narrative on the inquiry. So we really welcome inclusion here. I think the first thing we have to mention is the disproportionate representation of disabled people among COVID-related deaths. According to the Office for National Statistics, from January until November 2020, 59.5% of COVID-related deaths were of disabled people, but we need to note that that is only a minimum estimate due to the limitations of the available data. So the real figure will be much, much higher. Even when accounting for age and health-related factors, disabled people have been disproportionately represented, and there are a number of factors for that. Key among them are unequal access to healthcare, which was an existing problem before the pandemic, but we've seen that exacerbated through it. So a couple of examples of that are the use of the clinical frailty score in order to ration treatment. And there has been one particular study which showed overzealous use of limiting access to intensive care treatment in the first wave of the pandemic for people who scored highly on the clinical frailty score. And there has just been a Care Quality Commission investigation. They've just published their findings into unlawful use of do not attempt cardiopulmonary resuscitation orders on disabled people's notes. Another key factor is residency in care, group home and supported living settings, and that particularly applies to older disabled people and to those who are autistic and with learning difficulties. Reasons for that, again, are varied, but key among them were lack of adequate PPE in the early days, the discharge of patients with COVID who'd been untested in March and April of 2020, and the fact that within those group home settings, it can be more difficult to socially distance. You've got numbers of staff coming in and out of the setting, and people with learning difficulties generally have very low choice and control over their own lives within those settings. The third key factor is measures of deprivation. So disabled people are 3 times more likely to live in severe material deprivation than non-disabled people. There is a historic intrinsic link between disability and poverty being both cause and consequence of disability. The government continues to fail to apply the £20 uplift to universal credit to those on legacy benefits. Now, the 2.2 million, just over that, who are still on legacy benefits, 3/4 of those are disabled people, yet disabled people's incomes go up sharply in a situation of having to shield. So having to pay for your own PPE and the cost of online deliveries, etc. So some disabled people have simply been unable to shield. For those in the workforce, those who are in low paid jobs are again disproportionately disabled people and frontline workers, that means, and also those without access to sick pay. So I would say many disabled people have simply not been able to afford to shield.
Matt
I think that's where I'll stop on that.
No, that's okay. You've actually answered about 5 of my questions. That was really helpful. That's okay. Matt Hancock said that there was no need for national guidance establishing disabled people's equal rights to life-sustaining treatment as non-disabled people in April 2020. Now, why was that? And do you have any comments about that?
To have done that would have gone against the treatment rationing, directly against the treatment rationing guidance that was in use at a time when the NHS is overwhelmed. Then those kinds of very, very difficult decisions get forced onto medical professionals. So I want to stress that we're not criticising the medical professionals who've been put in these very difficult situations. And I know that some people will be living with that, and that is going to be very, very tough. But this is the reality of how things work. When there are limited resources to go round. I do think that the government wanted to avoid at all costs the same kind of images that we saw from countries like Italy with people on the corridors. They wanted to present the idea that, you know, they were in control, and particularly given the underfunding in the NHS and the way that I believe it has been run down with a view to privatisation, I think the government would have been particularly conscious of that image and withholding treatments and not bringing as many people into hospitals even as was needed was one way of trying to control that situation.
Now, your statement talks about hospital passports and specifically about people doing homemade hospital passports. Can you explain sort of what they are and why it became necessary for people to complete them during the pandemic?
Yeah, and actually this is quite personal, so I might get a bit teary in that I mean, I'm very lucky in that I don't have a physical underlying health condition. So I'm probably one of the only people in disabled people against cuts who hasn't had to shield for a year. So this is something my close friends and I've had to do for my mother as well. So the NICE did review the treatment rationing guidance after an outcry and the threat of legal action from disabled campaigners. So what they did was to add that it was also at the medical professionals' discretion after you've looked at and calculated the clinical frailty score. So disabled people felt that it was important to kind of influence that discretion and sought to create documents that they could take into hospital if they fell ill from COVID and were admitted to hospital. Key thing there being, a question mark over whether they would even be admitted, and to kind of persuade the medical professionals there that they contribute to society and they therefore deserve life-saving treatment, to counter the narrative in society that disabled people are nothing more than a burden on the economy.
Okay. I now have a question from a member of the public. Anne Pridmore from Leicestershire asks, why were disabled people who employ personal assistants never consulted or informed about how to support their employees?
Yeah, I mean, I can't answer Anne's question. I don't know why they weren't consulted, but I definitely agree with her that they should have been. It's notable that the guidance from the Department for Health and Social Care for people who employ, for disabled people living in their own homes, who employ personal assistants coming in and out each day for essential daily living support, the guidance was not issued until much, much later than for everyone else and for the rest of the social care sector, and only came out after concerted campaigning by disabled people. I imagine Anne was probably one of those, but also Baroness Jane Campbell, for example. It was only through disabled people at the time that they are most frightened for their lives, having to engage in concerted campaigning, that the government even realised they exist or remembered them.
And again, sort of talking about people going in, coming out of work environments. Another question, Alison Lister from Lincoln asks, by the time the government changed the rule for carers, many autistic people had broken down completely, ruining their lives and futures. Why were they so discriminated against?
Yes, and this was, again, another issue where disabled campaigners had to really fight for the fact that an essential need for disabled people in some groups of disability is to have support from those who know them, who understand them, understand their communication issues, and how they, what we need to function on a day-to-day basis. I think it was another case of just not considering disabled people because we are still so hidden in society and we were not considered a priority. In fact, I would go so far as to say that possibly there are those in power who saw this as possibly a useful opportunity to get rid of some of those of us who they consider a burden.
Well, I want to move on a little bit to the problems that disabled people had with their employers and those who specifically were classed as clinically extremely vulnerable. You talk in your statement about some of the issues that people faced with being refused deployment, not being able to be furloughed, not being able to work from home. Could you explain a little bit about what you have learned over the last year about disabled people having problems with their employers during this period?
I'm not sure I would say that we learned anything in that disabled people were discriminated against in employment and in the workplace, and that's for one of the reasons why the disability employment gap remains so, persistently high. I think it was disappointing that so many employers have been found to devalue their employees to the extent that they have been forcing them into workplaces and into work situations that have directly compromised their lives, put them at risk. So the research by Scope is what you're referring to that I mentioned in my witness statement, and that was very useful as a way of just putting some statistics on that, really.
There was a government strategy of public health versus the economy that you make reference to. Can you just tell the panel a bit about that?
Yes, I think that the way the government presented the situation was with the pandemic was that they were stuck with this binary choice between public health or the economy. My argument is actually that they didn't need to choose between, that actually putting public health first would also have benefited the economy. So, for example, if they had made the decision to lock down hard and fast at the beginning, then they might have been able to move out of lockdown quicker than they did. I think also there is perhaps a lack of awareness on their part how disabled people we're part of society. We exist throughout the communities, 21% of the population. We are, although, you know, I mentioned the disability employment gap, still there are many of us who are in employment. There are workers, as I said before, in frontline positions. So it wasn't a case of being able to you know, discreetly push away disabled people, you know, into their own homes in order to keep the country running. Actually, you need us in order to do that.
Yeah. Now, you're co-chair on the Commission of Inquiry on the Future of Social Security, which is, as I understand it, developing proposals for the future of social security. What are the recommendations that you're making in respect of, and I suppose what needs to be done now to protect and improve the lives of disabled people now?
We would say that we need an immediate extension of the £20 uplift to universal credit to legacy benefits. In the long term, what we're calling for is a guaranteed decent income set at minimum income standards, because we think that we need to move people out of poverty urgently so that fewer people will be impacted by this ongoing pandemic and any future ones. We are also calling through the Commission of Inquiry on Social Security. We are also linking with disabled people who are campaigning for a national independent living support service. We feel very strongly about that there needs to be better funding of social care that puts disabled people who use social care and social care workers at the forefront of priorities for that service.
Thank you. Ellen, I know that there are going to be some questions from the panel, so I'm going to hand you back to Mr. Mansfield, who I'm sure is going to have some questions for you. Thank you.
Yes, I'm just checking that I can be heard all right. Yes, that's fine. I do have a question. It's kind of melding a number of the points you've been making. Number one, we're certainly, in my view anyway, just as a personal view, we're in the middle of this pandemic. We're nowhere near over, and there will be conditions equivalent to this continuing for some time. So from that point of view, the importance of this inquiry is trying to answer queries that relate to the current situation. So assuming that that is a fair assumption, the next question is the tension you've mentioned between, and it shouldn't have been a binary choice, between the economy and health and mental welfare and so forth. That shouldn't have been a choice in that way. So that's the second factor. The third factor is assuming there might be a third wave, which has been assumed by a large number of people. Never mind where it comes from, never mind what strain it is. This is the question I'm getting to, because you still have quite a dichotomy between those who think that the way to deal with a pandemic is, in fact, and they employ these terms, or they did originally, and now they've gone off using them, but the herd immunity approach to life, and also the fact that, you know, maybe we don't need a lockdown. Maybe we should just have a simple regulatory pattern and scheme. And then what's cited every time as the glowing example, apparently, of Sweden. So what I want to ask you is, because you've got an interesting section of your report, page 36 onwards, in which you deal with Sweden and perhaps dispel some of the myths. Yeah. Could you just develop that?
Yes, I certainly can, because I have been very aware that we heard a lot about Sweden at the beginning of the pandemic last year. I think things have gone quite quiet on that front since the publication of the findings of their national inquiry. And the findings of that were that the government had handled it wrongly, and the Prime Minister has since come out and admitted that. I don't think I have come across any mainstream news coverage here that's recognised that factor, or of what led to that, the national scandal in Sweden. The national scandal was caused by the fact that by not locking down, in fact, the government were even telling members of the public not to wear masks. They put at risk disabled, and particularly older disabled people within the community. By not locking down, it meant that there were a lot more cases of younger people. So, for example, school children who were catching COVID and were hospitalised and needed those hospital services. So in order to protect the hospital services so that they could be kept for younger people and in work, who was who they were prioritising in order to keep the economy going, they wanted to make sure that they weren't filled up with older and disabled people. So there were directives from the regional health authorities which told care homes not to admit anyone from their care homes who contracted COVID. They've had a similar situation in Sweden to here with privatisation of care services. Many of those homes did not actually have access to oxygen or the treatments that people with COVID need. So in order to stop the suffering of those disabled and older disabled people, what was prescribed to them instead were palliative care drugs. Now, those palliative care drugs actually slow the respiratory system down. So if you already have a respiratory condition, as with COVID, then what it does is hasten your death. And so relatives were largely not informed that this was what was going on. They were told their relatives had COVID, and then a couple of days later, they would find out that they were dead. It was only after that first wave that people started finding out what had actually been going on. And the thing that I think always gets underestimated by governments is how actually people care about each other. We care about our loved ones. It might not matter that that person only had perhaps 6 months to live under normal circumstances, but if they die prematurely, having had their deaths hastened without their family being informed, dying alone, then people really do care. So there was an outcry, a national scandal in Sweden, which led to this, and which led to the exposure of that strategy that the government employed. I hesitate to say herd immunity, because scientifically you can't do herd immunity without a vaccine being available. Before Sweden chose their approach, there had never been a case of herd immunity being tried without a vaccine. So there were actually numerous petitions, letters. The scientific community in Sweden were pressuring their government. They were calling out to them at the beginning of the pandemic that this just is not robustly scientifically credible. And yet what we heard over here in our news was, how, isn't Sweden brave? This shows we don't need lockdown.
Can I just ask you a quickie to follow this up?
Yes.
Are you aware of whether the influence of Swedish policy and politicians on the British politicians and contact? Was there any at the early stages?
I'm not aware at the early stages. I think there was communication, yes. I don't have to hand the references on that, but what I am very aware of is that Anders Tegnell, who's the chief scientific advisor to Sweden, advised Boris Johnson over the summer when the Prime Minister avoided implementing harder lockdown measures during the summer period.
Okay, thank you. I'm going to see if there are any other questions. Is there anyone else wanting to ask a question of Ellen? No, I don't think so. Is there anything you want to add yourself that you haven't? Oh, sorry. Yes, there is. do go ahead, Dr. Annie.
Thank you. And thank you for that really important statement and responses. My question is, fast forwarding us a little bit to the moment and looking to the future, particularly around vaccination. So can you, because we haven't spoken about that specifically in the context of access, can you share a little bit of what your experience has been in terms of that coverage, and perhaps if there have been any lessons from the pre-vaccination era that may have been applied there, or what you would like to see happen, because obviously we'll be vaccinating for a while to come?
Yes, I think this is a very difficult question, in that disabled people who are so aware of how at risk they are and how dependent we are on services are very keen, obviously, that as many people are vaccinated as possible, particularly social care workers. However, there's also a tension in people such as social care workers, who obviously want to do the best for disabled people, but feeling that they've been bullied and harassed by employers, and ideas around coercion of people. And I suppose what question this raises for me is about the lack of trust that people have with our government, the establishment, as you might want to call it. And disabled people's experiences since 2010 are directly relevant in that we have seen the impacts of austerity and welfare reform, which have been extremely brutal, deliberately targeted at the poorest and most disadvantaged. And so where I live, for example, here on the estate in South East London, there was, for example, very low levels of mask wearing. Even at the height of the pandemic, I would say not more than perhaps 40% of us were. And to me, that it goes hand in hand with this idea that the social contract is broken and people have lost faith in what people are telling them and what the mainstream news is telling them. So it does worry me that about, I suppose, any measures that are taken that feed into that disconnect that people have, disenfranchisement from society, I'd say. That makes sense.
Any other questions, or are we happy? Yes. May I just take the time to thank you very much for giving up your time and giving evidence to the inquiry, and we wish you well in your work. Thank you very much indeed.
Thank you.
May I now